get started. Hi, everyone. Thank you for being here with our team today. We're very excited to hold another webinar, and this time it's focused on private and public healthcare. You'll see today our experience, our process, some client success stories in really reaching hard to reach audiences within the healthcare space. Before we get started, I just have a couple housekeeping things that I wanted to mention. We are recording today's session so that we can share it out with folks who are unable to join us today. So if you'd like to keep your cameras off, please do so now. If you have questions throughout this webinar, please send them to us through the chat box throughout the webinar, and we'll go through those questions and any other questions that you have in a Q&A session at the tail end of these next 30 minutes. And of course, if you have anything that you would like to chat with us about further, that either we didn't cover today or that you'd like to know more about, you can certainly reach us directly at info@rdwgroup.com. So I think that's everything on my end. With that, I will hand it over to Giselle.
Thanks so much, Cassie. Welcome, everyone. So excited to talk with you here today. And we wanted to start off with this statement: even with the best of intentions, getting our message out there can be a challenge. Even as experienced marketers and communicators, and even with the best of intentions, we know getting our message out there can be a challenge. We need to look no further than the past 2+ years now of COVID as an example. But this challenge existed long before COVID, and it will exist after COVID as well. Today, we're going to look at data-driven insights and opportunities to reach some of our most vulnerable, niche, and specific audiences. So let's start off with a few introductions first. My name is Giselle Mahoney. I bring more than 15 years of marketing and communications strategy and execution to my role here at RDW Group and to our clients. I'll say that those 15 years have gone by so fast. One of my favorite spaces to work in is healthcare, and it's because it's an opportunity to make a difference in the world around us. I'm sure this is one of the reasons that you are all here as well. So excited to have you here. Joining me today is also my colleague, Ryan.
Thanks, Giselle. Hello, everyone. My name is Ryan Mackesy, and I'm an account executive here at RDW Group. I have a predominantly digital background and as well as brand strategy. I have over 10 years in digital marketing experience across a variety of industries, but lately, as Giselle was hinting at, and the focus of this webinar, I've been working a lot with public and private healthcare in both the B2B and B2C verticals, along with some really varied experience across consumer packaged goods and some other fun niches as well. So very happy to be here today to talk to you guys about how we can really get in front of those hard to reach audiences. So as Giselle was starting to hint at earlier, and as we've started to paint a little picture of with just the two of us, like our diverse backgrounds, RDW Group pieces together a full tapestry of a holistic marketing partner. So just to talk a little bit about us before we get into the nice meat and potatoes of how to reach these audiences. Unlike the specialized nature of ad agencies past, we recognize the importance of and employ the full interplay between every aspect of a successful communication strategy. So like the colorful puzzle pieces on the screen in front of you today, one does not function completely without being linked directly into the others, completing a full spectrum of success for our client partners. So from traditional advertising to digital marketing to psychographic research and every angle in between, we lead our clients through a very research-driven approach to success, and you'll see that come up a few times throughout today's presentation. And while it's tempting again to look at all these as individual pieces and tactics like they're shown here, we're really advocating for a strategy-first approach that really looks at this as an entire tapestry. So we use data and insight to determine the ultimate tactical mix for strategies, rather than setting out to employ, say, a social media campaign or an outdoor campaign. We set out to develop a holistic strategy for the goals at hand. And speaking of experience, just a little screenshot here of some of our healthcare partners that we've worked with over the years. And this is private and public sector. We've gotten to work with a lot of really cool and meaningful projects that have driven a lot of what you'll see our mantra come up a couple times throughout this too, we call positive change in our communities. So just a little screenshot of a few of our awesome partners here, some of which we'll be talking about as we go through as well.
Great. Thanks so much, Ryan. I love working with those clients. Now let's jump right into today's topic, how to reach your hard to reach audiences. How about we start with a question for each of you here today. What have you done, or what do you want to try to do to reach your hard to reach audiences? It can be ideas, it can be tactics, anything you can think of. Feel free to put your thoughts into the chat. What have you done to reach your hard to reach audiences in the past? Or what would you like to do? I see social media pop up. That's a good one for sure. Any other thoughts? All right. Collecting first-party data. Yes, for sure. Great. Excellent. We'll be talking about some of these tactics going forward here, and also the role of tactics in a holistic marketing strategy, right? Because tactics are one part of the execution, but it's certainly not the only way to go. So how do you start onto that conversation? Here's a fun fact for you. Did you know that an individual forms a perception of your brand in less than 5 seconds? And in just 50 milliseconds, which is 0.05 seconds, your brand is making an impression and sparking questions with your audience. That's pretty quick. We need to make sure that in those very few and very fast seconds, and for every second thereafter, you are conveying your story to the audience that you have worked so hard to reach. Let's take a look at just how we might do that. And before we do that, I saw something pop into the chat. I'll just check it real quick. Developing cultural relevant messaging to help motivate a desired behavior. Absolutely, absolutely. Know who our audience is. Great. So for any project that we embark on, there are what we call foundational elements, right? We can't build a campaign, we can't build a strategy, we can't build any communications at all without these foundational elements. And this is the case for any project, but especially ones with such specific audience needs. So those elements are, what are the goals of the project? Who is your audience? What is the situation? What calls to actions or CTAs do we want our audience to take? How are we measuring success? And also timing and budget are two important elements to consider as well.
Thank you, Giselle. Those are absolutely some serious goals that we need to take into consideration right at the top. And if we take all of those foundational elements that we just walked through into consideration here, we flesh them out into yet another colorful connected capabilities illustration here. So how exactly do we implement all of those elements into a successful outreach to your audience? Well, there's a process that we've time tested that we advocate all of our clients to take in order to do so. And this is a quick overview snapshot of what that process looks like. And we can dive a little bit further into each one of these as we go through. So we really break it down into 5 key steps. The first step is discovery and research. Second would be your actual brand development and testing with your audiences. The third step is where we actually develop the strategic communications plan. Fourth would be producing your creative. And then 5 would be actually going live with media placement and then the ongoing process of reporting and optimization. So let's take a little look at the discovery and research phase first. The very beginning of this, we look to do, and we advocate that you do this internally, meet with all of your stakeholders and your key partners with any initiative that you're going to be going forward with. This involves a lot of ideation between teams that can come up with some very helpful insight in how you might actually reach these audiences. Next is really putting your nose down in the books and doing a deep dive into research. This is where you take any research that you might have already and also take the time to do audience research with different media platforms and demographic research that can help guide your strategy going forward. And then very importantly too, you want to review and audit the landscape of not just your competitors, but the industry as a whole, because this can reveal some really strong trend possibilities that you might either be able to tap into or look to stand out from in the crowd. The next phase, brand development and testing, is where we start to actually bring some of the learnings from that first phase to life. So first, you'll want to develop a messaging and positioning development stage here. This is where every learning that has come from the research phase, from those initial ideation sessions, are actually fleshed out into brand positioning statements and messaging that determine how and where you're going to talk to your audiences. Next would be actually creating concepts out of these ideas. So depending on what ultimately your strategic communications plan ends up being, this can be an array of assets. This can be developing visual assets, written communications, audio assets, and everything in between. And like we showed with our rainbow circle earlier, there are certainly a wide array of considerations depending on what is determined to be most optimal for your audience. And then possibly the most important one of not only this slide, but of this entire process for that matter, is creative testing. This is really important because research is extremely informative, but nothing is ever going to be as honest with you as to whether or not your message is hitting home as your audience themselves will be. So we always encourage that our clients and anybody that we work with for that matter is putting their creative out there in front of their audience for preliminary testing. There is almost always something that comes away from that as a key learning that you just can't get from just a research phase alone. Next is actually going to toss back over to Giselle to walk through our strategic communications plan process and what you can do to actually get these messages in front of your audiences. Giselle, I think you might be on the mute there.
I am muted, still the catchphrase. All right, so step 3, building off of data, research, brand development, including messaging and creative, as Ryan talked about, and testing, very important element of the whole process, comes the development of a detailed communications plan. You can think of this as a roadmap for your campaign or for your outreach efforts. It should include your brand positioning, strategy, key opportunities, performance metrics. We always want to measure everything we can, and recommended tactics to bring the plan to life. So that's where some of that conversation in the chat comes into play. These tactics can be what we would call traditional media. They could be digital media, earned media. It's wherever the process leads you to best reach your audience. Specifically for our conversation today, reaching hard to reach audiences. This plan would clearly define your audiences. This is the communications plan, would clearly define your audiences, who they are, what their media consumption habits are, where to reach them, and where their mindset is. One opportunity you might want to explore is developing persona and journey maps for your audience, just to completely flesh them out a little bit more, bring them to life. And then all of this is working together, as you can see on the screen here, is creating a campaign that is audience-centric. All the tactics are pointing back towards your target audience, including paid, earned, owned media, all focused specifically on your defined audience.
Thanks, Giselle. With all of our strategic elements in place, we're now moving into the part that is very exciting, where your campaign and your strategy comes fully to life. So this is where you actually develop the creative to execute the strategy from our previous couple of steps. So the biggest part of this is what we call the strategic creative brief. This is summarizing all of the findings from your research, from your testing, from your media and audience research, and your communications plan into a clear-cut set of questions that can guide exactly how you execute on your creative and brand positionings to build out all of your ad assets needed for your communications plan. So speaking of building out from there, once you have your brief, you can use that to determine this messaging is going to permeate across my video assets, my banner assets, my audio assets. And this is where that actually gets built out and getting ready to go into market with those messages. And then, of course, the ultimate awesomeness of it is seeing the final versions of those creatives. So this is where you actually have those assets ready to go out into the wild. And then speaking of the wild itself, in the media side of things, talking about getting that message out there, we also want to look at the media planning process a little bit. So in the initial research phase, there's going to be audience research of a variety of methods going on, everything from motivational messaging research to actual demographic and media placement research. So with media planning in the pre-planning stage, we want to make sure we understand where your audience is consuming media, where they're consuming trusted media, and how they interact with that media. Then in the planning phase, we take those pre-planning learnings and actually flesh out where these assets are going to go out, whether it's going to be, say, a display network partner, an outdoor advertising campaign, or even something a bit more boots on the ground. And then finally, we hit that go live button and bring it out into the execution phase. This is where we actually press go on that entire strategy and send this out there to your audience to see how things resonate. And now this also is, I would say, the most important phase after testing. And this is an ongoing process, so it's a bit of a misnomer to have it be the bookend here. Evaluation and optimization is really just as important as having a good strategy to begin with. You need to be flexible and you need to be able to look at trends that are going on, not just within the industry, but within your own campaign once you get out there in the wild. So evaluating what's working, making changes based on what's not, and making adapting changes as you go along is going to ensure that you're getting the most bang for your buck and that your message is actually resonating in the way that you wanted it to from your strategic communications plan.
Great. Thanks, Ryan. So we've walked through the 5 steps of the process, and now we're going to show you some of that process in action. We have 2 examples for you today. The first example is a campaign recently completed with the Rhode Island Department of Health. It was focused on reaching childbearing individuals who may be using opioids or other substances during pregnancy or afterwards. So I think we can all agree this is a pretty challenging and hard to reach audience. The challenge here is annually at least 500 Rhode Island babies are exposed to substances in utero that have the potential to affect their health and development. Of these, about 20% are diagnosed with neonatal abstinence syndrome. Our goal was to reach mothers with substance use disorder and try to prevent or mitigate newborns with substance exposure. So we did this through data provided by the Rhode Island Department of Health. We conducted in-depth interviews with healthcare providers and social workers focused on this space. We collected anecdotal feedback from the project team. We leveraged RDW's own experience in this category. And most importantly, we went through several rounds of testing with our target audience directly. We held focus groups and one-on-one interviews with individuals using substances or post-pregnancy and currently in recovery. We met them at halfway houses and we met them at treatment centers. Our findings were invaluable to best understand their mindsets, what messaging and imagery resonated with them most, and where we might want to place ads in order to best reach them for a campaign. What we found was important, and it seems kind of common sense, and Ryan said earlier, sometimes you find things unexpected. In this case, we found our audience just wanted to be treated as human beings. Pretty straightforward. And they wanted to be treated as moms, right? It was our priority to ensure that we talk to our audience as moms first throughout the campaign. We needed to be real, no Instagram perfect photos in this campaign. We needed to be open-minded. We needed to be open to hearing these moms' stories and helping them move forward versus taking an approach of lecturing, shaming, and telling them what they already know, that using substances while pregnant is unhealthy. We also learned some of the best tactics to reach our audience. We learned out of home, such as billboard, bus stop panels, bus sides, mall advertising tactics were good choices, and also digital tactics such as social media and contextualized online display were great opportunities as well. Some of these tactics were mentioned earlier. You can see here on the screen that these are some of the iterations of creative that we developed and tested for this campaign. We then refined the tested creative and we tested it again. There are some extraordinarily nuanced approaches to take in reaching this audience. For example, if we look at the creative on the left, this was the best performing creative in our initial testing. But our audience asked us, is this mom sleeping or did she overdose? So that was something we needed to address. The next image to the left, the woman wearing the bathrobe, our audience felt like the bathrobe connoted affluence, so they didn't feel like it related to them. The Black mom and baby at the top, in the middle, the baby looked too healthy to our audience, right? So a baby born with substance use exposure might not look as healthy, and they wanted, again, they didn't relate to this image as much. The other two testing stimuli performed well, but it didn't have that immediate grasp with the images of the mothers and the babies, and also they felt like there was too much text. They already know the consequences of their actions, and they didn't need us to tell them on this poster, on this testing, what those consequences were. So less text was better. Here on the screen is the final creative and messaging direction that we used for the campaign. You can see it's real, it's authentic, there's short, very limited copy, and it's engaging. It shows the mom and baby bond that we are trying to highlight throughout the campaign. The campaign ultimately was deployed across 8 weeks. Tactics included paid social media, paid search, digital display, and out-of-home advertising. We leveraged owned media through RIDOH and its partners organically through social media. And we developed a custom landing page in English and Spanish to support the campaign. With the ads, when our audience reached the landing page, our main goal was to encourage them to call for support. And here are our results. We saw 1.8 million plus impressions from paid digital tactics. We saw 6+ million impressions from out-of-home tactics, almost 3,000 website sessions in both English and Spanish. We saw just under 18,000 impressions from paid search, and we saw more than 1.4 million impressions from digital display. Anecdotally, we received positive feedback and support from the community and healthcare providers. They thought this campaign hit home for them and really tried to reach that audience with the messaging and the images. As a result, also, we are currently working with RIDOH on a second campaign. Ideally, we want to be in the market for as long as possible with campaigns like this, because there's always folks in need of these services, and it takes time to not just reach people, but also encourage them and have them be ready to take these real life-changing actions. Ryan,
Absolutely.
back to you.
Thanks, Giselle. Certainly a very hard to reach audience, and the learnings from those focus groups were definitely some of the most crucial that we've seen in some time. So I think that was a great example of what listening to your audience actually really looks like in practice. Looking at another really hard to reach audience, we want to show one more case study here for another client partner of ours, looking at how we reach individuals and families who lack access to affordable health insurance. So our client here was HealthSource Rhode Island, and we were really tasked with the unique challenge here of trying to reach what is ultimately 3.7% of Rhode Islanders in 2019 that remained uninsured. So HealthSource is looking to connect these folks with affordable healthcare insurance options. The goal is really health insurance for everybody, as we know. So our insight into how we were going to be able to accomplish this, we really wanted to look at a motivational direction for this one. Looking for health insurance can be very intimidating. I mean, looking for insurance of any kind can be intimidating. So imagine when it has to do with your own bodily health. So our insight here was that people are more likely to be able to pursue this if it's an easy way that they know is able to protect themselves and their loved ones. So taking a look at our approach here with a couple of screen grabs of what our creative ended up being, we really wanted to reinforce that need to protect yourself and protect your loved ones, but not just the need, but also the ease of ability to do so. We wanted ease to permeate throughout all of these creative executions, throughout the website experience, and throughout every step of the process. So we focused on creating very visually engaging, very easy to understand, and very frankly, cool looking informative videos that combine some animated aspects with some live filmed aspects to explain just how easy this process is and how this can benefit folks that might not be enrolled in health insurance yet. So looking at our key tactics for where we actually put these out, we leveraged a pretty strong mix here of traditional and digital media tactics with the main goal of raising awareness and ultimately driving enrollment of those uninsured Rhode Islanders. We spoke to a group that I will consider myself just coming out of, which is called the Young Invincibles, us folks who believe we don't need health insurance because nothing bad could ever happen to us. Well, that's just not the case, and it's also just not as intimidating as it should seem to be. So we really promoted to that audience with website tools that were on the cutting edge of ease of access and helping customers find the best insurance options with online comparison tools. And the results really speak for themselves. We had 32,704 Rhode Islanders that were enrolled in health insurance as a result and during this campaign. And that's a substantial year-over-year increase from prior to when we were out there with this messaging. So it really shows that it hit home, and it also shows that the overall experience was something that the customer was able to interact with.
Thanks, Ryan. So as we prepare to close today's session, that 25 minutes has already gone by so quickly. Here briefly are 5 key takeaways that may help you as you're developing plans to reach your own hard to reach audiences.
Thanks, Giselle. So first and foremost, and this one might seem obvious, but it bears repeating, you need to know your targets. And what that means is you need to research and understand their demographics, but not just demographics, but their mindset and where they consume trusted media. Second, you need to keep a pulse on your peers. And that's not just referring to your competitors, but it's also referring to your landscape in the industry you're in as a whole. You really need to understand current trends in communication within your industry and take a look at what your competitors are doing. Because in some cases, you'll be able to find things that also might work for you or things that you want to differentiate yourself against in the market. Next, and possibly my most favorite, you need to embrace the word no. You truly need to hear your audience and take their feedback to heart during the research phase. There is one thing that we all know when we're going into a campaign like this, and that's what we want to say and what we want people to understand. But what we don't know until we talk to our audience is what they want to hear and how we're going to meet them in the middle. So this step is very crucial, and you need to be able to understand that no is not always bad. It's an opportunity for you to better your message. And then also, speaking of making lemonade out of something, you need to be willing to fail a little bit with this too. You need to observe and adapt pain points throughout your ongoing campaigns and use those learnings to better optimize your strategy throughout. These campaigns and strategies that you'll be employing are living, breathing, evolving tactics, and they're not just set and forget. So you need to be able to observe, be willing to take chances, and be willing to cut losses and try new things when it calls for it. And then finally, you need to understand the journey. And what that means is that you need to allow your strategy a little time to breathe, particularly when we're talking about hard to reach audiences, and especially with healthcare audiences. There is going to be a bit of a funnel. People need some time to develop trust and to fully understand what you're trying to communicate. So let it breathe, understand the journey that your consumer is on, and adapt as you go along.
Great.
Amazing. Thank you, team. Thank you, Ryan and Giselle. We do have a couple questions that came through, and I know we're up against time, so I will try and ask 1 or 2 if we can sneak them in. Someone has asked, as a healthcare organization, a lot of our audiences speak different languages. How do you go about identifying and connecting with these individuals?
Sure, I can jump on this one, Ryan. That's absolutely a valid thought process in developing any communications plan. It's understanding who your audiences are, and it's cultural, language, and it's not just what language do they speak, right? It's more than translating an English into Spanish. It's understanding the nuances of that culture, of that language, and how it would be received. So sometimes we'll actually run 2 different campaigns, one for an English-speaking audience, one for a Spanish-speaking audience, just to make sure we're ensuring we're resonating with our imagery and our messaging in the most appropriate ways.
Thank you. And I'll ask one more. Testing sounds expensive. Someone said, can you work around this if your budget does not allow?
Yeah, that's a great question, and I can go ahead and jump in on that. Testing does not have to be expensive, and of course, it depends on what you're looking to do. Obviously, we talk a lot about focus testing in here, which is a very valuable form of putting creative in front of folks for feedback. But there are less expensive ways that you can get feedback on your messages, from things as simple as surveys out to lists of your audience. So even if you don't have all the money in the world to go into a robust testing program, we would always encourage that it be at least a primary small portion expenditure of your overall strategy. Because ultimately, if you shave that cost and put out a message that doesn't resonate, it's going to have been sunk money anyways. So we would really encourage, even if you're just doing a cheap alternative, like doing a survey testing or even an internal testing within your colleagues and peers in the industry, that would be the best way to go about it.
Great. And I'll ask the final one that I'm seeing here, kind of to that same tone, Ryan or Giselle. How do you know which tactics are best to reach certain audiences in this space?
Yeah.
Go ahead, Ryan.
So speaking a little bit to that, it's really kind of a two-sided coin, and I will try and keep it quick because I know we're running a little bit over here. But It's two sides. One, we want to understand where they're consuming the media, and we do that through, and we would encourage anyone to do that through market research data. There's things like Nielsen numbers and other avenues that you can explore to determine just where your demographic is actually living and consuming media. But then the other side of the coin is doing things like messaging research within your industry and looking at the way that other companies and other entities are talking to your audience to determine the actual verbiage of what you put out there. Because again, if you put something out there in the right place, but it's saying the wrong thing, it's ultimately not going to bring you across the finish line. So really, you want to look at those two sides of the coin, where they are and what they would like to hear and how you can meet them in the middle.
Thank you so much, Ryan, for that. If anyone else, I know we're kind of time a little bit over, so if anyone else has questions, please email us at this email that you see right in front of you. We'd be happy to jump on a phone, email you back, whichever you prefer. Thank you, Giselle and Ryan, for leading this very insightful presentation. We will share the recording with everyone following this, so keep an eye out and have a great day, everyone. Thank you so much for joining.